I'd like to take this opportunity to thank Sages for asking me to present a little bit of updated information on the standardized mesh labeling initiative and identification. Obviously, this is a different kind of meeting than what we're used to, but hopefully we'll be able to fill you in a little bit on some of the work we've been up to. These are my disclosures, none of which are going to be relevant for the talk that we're going to today. Objective 3 is kind of standards and practice in medicine. Where are we now, and where do I think we should go in the future? So for a little bit of background, I want you to kind of think about when you go to the grocery store and go shopping for some food. It's very easy if you go to the soup aisle to compare a couple different cans of soup. You can take a look at the label, and all the information is presented in an easy to compare, standardized fashion from one product to the next. And this was a complicated process to get to this level. It actually started back in 1966 with a law that was called the Fair Packaging and Label Act. This law required all consumer products to honestly and informatively label what was in it. And this included foods, drugs, cosmetics, and even medical devices back at that time. But it wasn't until really the 1990s when the Nutrition Labeling and Education Act standardized that nutrition label that we're all used to seeing nowadays. And in addition, it also stabilized some terms that we see a lot of times that included low fat and light. And for those of you who are familiar, know that everything's presented in the same way with the same information from one product to the next. But this was not a simple process and ultimately required an act of Congress and subsequently a federal law to get to that point of just having that label on your food product that we're so used to seeing. And the challenge is there are really no similar mandates that apply to medical implants. So when you get a piece of suture or mesh, there's nothing that kind of standardizes or mandates how that product is labeled in a standardized fashion. Now, there has been some work to get a little bit of forward progress in this factor or in this category. This goes back to the labeling of medical devices done by the Global Harmonization Task Force. This was over 20 years ago, where they set out to standardize that all product labels should include the name, manufacturer, as well as the details for the user to identify what is in the product, including both the lot number and the expiration date. Other efforts have been done by the ASTM, which is the surgical standard for labeling and testing of materials. They went to the effort of describing a universal label format for orthopedic implants. This kind of came out in 2013, but it ultimately relied on manufacturers to both embrace and implement this product labeling standardization, but has actually come a long way, but is limited to orthopedic implants. The International Council for the Commonality in Blood Banking Automation, which is a complicated acronym, but worked with the World Health Organization to create a standardized method for terminology coding and labeling of medical devices. But again, this had some limitations as it's only appropriate for human origin based products. Not to mention, it's a very complicated device identifier, including several numbers and letters along the way to kind of identify the different parts, the serial number, the expiration date, but really doesn't provide that much useful information for the end user, which is the surgeons like us who implant or use these products on a day-to-day basis. So even though it did give you some basic information, it really doesn't give you a lot of useful information about the specifics of that mesh that you plan to use at that time. So we, with this information in mind, we set out to get a little bit of better understanding of what current mesh products have and what information is there. And what I can tell you is it's really not a lot. So we went through 36 different commercially available meshes that were actually all stocked on the shelf in our hospital to kind of see what information was available, not only on the packaging, but also in the labeling on the mesh itself, and found that just under 3/4 of of meshes reported what the base material was. And that was the greatest. It got even less for filament type, whether the mesh was absorbable. And for those meshes that were absorbable, we really had no information what the resorption time was from one product to the next. So what options do we have now? Well, there's been some work done by the Food and Drug Administration to develop what's called the Good ID, or the Global Universal Device Identifier database. And this actually is a good step in the right direction. It does contain some key device identification information and presents this with a standard number and barcode. And this is actually on most products that we use nowadays. And if you actually go to the Good ID website through the National Library of Medicine, and if you just search for the term mesh, it comes up with over 19,000 different unique products. And I'm sure this is growing on a day-to-day basis. And so from there, you can go and pull up individual device identifier information. And so here's a sample of some of the information that you get. They'll give you the brand name as well as the commercial distribution, some less useful thing like the catalog number, but it also gives you some additional information about the device description. So what it's made of, if it's got a different color, and those sorts of things. And when you start to look at some of the device characteristics that are there, unfortunately, that becomes even less limited. There's really nothing about the mesh itself. And it requires you to go online and actually search for the Good ID database, and that it's not readily available at the time that you use the product itself. So where do I think we need to go? Well, ultimately, I think the next step from here is to do a little bit of work looking at a standardized mesh label. So this was a proposal we came up with a similar paper that we presented earlier, in an effort to kind of take that same standard label that we're used to looking at from a food standard, but providing mesh in the same way, with the goal of presenting useful information in a consistent format that will make it easy for surgeons to use at the time that they're making a decision on what mesh they're going to implant into patients. So ideally, what we would be able to do is potentially tie this in with a good ID tracking number that will allow us to improve identification. That can also be linked into different EMRs. So when you decide to use a mesh, it will not only track the specifics from there, but it will also allow us to take advantage of implant registries within EMRs to help track serial numbers of implants and provide better long-term follow-up of what's given. So I think what's some things that we can do now to help ourselves along the way? Well, I think what's helpful for each surgeon is document the kind of mesh that you use in any operation. So not just appropriately sized mesh, but the specifics of the brand and what size it was. This will really help those of us who operate on recurrent hernias to get a better understanding and potentially provide more long-term tracking for issues with mesh failures or different complications along the way. And ideally, if you have the opportunity to identify the lot number within your operative dictation, these are usually tracked by your nurses in the operating room, but they can be difficult to access after the fact. So just to summarize, I think that certainly we are behind the ball in standardizing mesh labels. I think there are opportunities for us to make significant improvements, but it isn't going to be easy, and ultimately requires us all to do our part to move things forward. I'd like to thank you for your time and appreciate you listening to my talk today.